So we're continuing to utilize old descriptions or descriptions from earlier osteopathic literature, speaking about technical applications, talking about them, giving some generalized concepts, so that the descriptions that were written will match up with concepts that I discuss from time to time. Now the one we're looking at today is Charles Hazzard speaking about treating the soft tissues of the neck. Now I'm not going to show exactly what he says, but I'm going to show the concept. So again, we get the relational value, the value of looking at what was said early on, maybe doing it the exact same way or doing it a slightly different way for the same net result. When we're speaking about working in the neck, now based on the shot you don't see the neck perfectly, and that's okay, because as always we'll go ahead and we'll make sure that we have a few visualizations so you can see what's going on. Now he speaks about first working on the SCM and working on the posterior soft tissues and varying soft tissues. He speaks about working across table. Now when you're working across table in the region of the neck, if I was standing and I'm reaching across, it works okay because I won't choke the person. So just as when you learn CPR or you learn first aid techniques and first aid methodologies, you're always told to take the pulse on the same side of the neck. The reason is because if you reach across the neck and you're fairly level, you'll cross the midline of the neck. You could possibly choke a person. In the case of manual therapeutics, it's very unlikely you'll choke a person. It is not unlikely that you'll make them uncomfortable. You probably will, because you may not be paying attention to your whole arm. You may be only paying attention to where your hands or your fingers are. So were I to work on the SCM, on the left SCM, I'd be on the right side of the table. I'd be standing, right? So there's enough of an angle in my arm that I don't end up choking my patient. In this case, we can show the same thing, but working on one side. Now, specifically with the SCM, what we would do in the case of sitting here at the top of the table is I would end up molding. So the concept of get as much as you can touch with palpation and molding essentially to the topography of the anatomy that I'm looking at. So with respect to the SCM, a hold somewhat like this will allow me to span a large portion of it, because in this, so if my finger happens to be an SCM and I just go to grab like this, it can be quite pokey. I can be poking against the neck, so I can go on the posterior border or on the anterior border. But if I simply kind of make a shape like this with my hand, I can grab the majority of the SCM. Now what Hazzard talks about, in his case he's talking about standing on the opposite side of the table, but what he speaks about is working on the anterior border and the posterior border, holding on to that tissue and moving the neck, right? So holding the forehead and moving the neck. So what we have here is a few things. So with respect to palpation, as I already spoke about, get as much as you can touch, mold to the topography of the anatomy. We have, with respect to soft tissue, as I've spoken about with other early osteopathic literature, it's talking about working perpendicular to fiber direction. So in this case, because I'm surrounding the SCM, what's going to happen is I can go across fiber direction. So I can lift up to work on the posterior portion or the posterior border of the SCM. I can push down towards the table to work on the anterior border. Either way, I have broad contact for multi-point discrimination. So in my hand, in a fairly sensitive portion of my hand, I can feel the tension in here. And so we have that, and then we also have relational motion. So one thing stays still and one thing moves in relation to it. So I can move the soft tissue perpendicular to fiber direction, or I can hold on bind. So I can find some bind within the soft tissue itself, and then I can move the bones underneath it. So I can move the head and cervical bones or cervical vertebrae in relation to the stationary SCM. He speaks about that. Then he also speaks about the posterior tissue. So if I just take my hand from this posture and I wrap around to the posterior side, now you won't be able to see this, but my fingertips will essentially start to feel the spinous processes of the cervical vertebrae. And when I feel that, right, understanding that it is covered by quite a bit of soft tissue and it is somewhat anterior, somewhat obscure, what I'm going to do is I'm going to identify it, and then I'm going to move lateral to it. So once I find those spinous processes, I move slightly to the side, right? So what I'm doing is I'm holding the multiple layers of soft tissue, and I'm going to begin to pull them away from the vertebrae. Now the reason I'm doing that again is to work perpendicular to fiber direction. So I pull away, right? Now because I can wrap my fingers, I can start to mold the topography of that anatomy. I can have fairly broad contact. And I can also, again, wrap. So I can create situations where I can hold a fair amount of tissue by wrapping my hand. Find those SPs, pull away from midline, and then again, I can use relational motion. So working perpendicular to fiber direction, broad contact for multi-point discrimination, relational motion, just working through these concepts. So he's speaking about this in slightly different configurations for the practitioner and the patient, right, where the practitioner is often standing in his descriptions, but it's the same concepts over and over again. Also speaks about working on the hyoid. Now the hyoid for most people is quite high up, and you're very likely not to actually palpate it or get particularly close to it, but you can get in and around the thyroid cartilage fairly easily, and the cricoid cartilage, and just kind of right in here around the Adam's apple in a more colloquial sense. So what you can do, if you just use your finger pads and you're very gentle, you don't cross the midline so you don't start to make your patient very uncomfortable, you can come in and very gently, just very, very gently, you'll be able to identify some lump, right? Some hard lump that's not soft tissues. If you can get that lump, then you can start to work on the hyoid musculature, the infrahyoids and the suprahyoids. And again, perpendicular to fiber direction, right? So the fiber directions are more or less like this. If I can start to glide that very, very gently. So some people will stand and they'll hold like this. They'll hold kind of more in a claw. My general preference, even though I can't necessarily see what I'm doing because the patient's chin is going to block my vision, I understand what's going on. I'm still going to look at it. And in my peripheral vision, I'm going to see the patient's face if I'm making them uncomfortable. In motion tests, right, so the patient likes to glide this way, doesn't like to glide this way. And I can hold, right, so one thing stays still. Come up here, one thing moves in relation to it, right? So as I hold my hand still, as I've essentially translated the hyoid and related components across the anterior midline of the cervical column, I can hold that and then move in relation to it, right? Or I could just very gently on and off. But again, it's perpendicular to the general fiber direction of the muscles above it and below it that attach to it. We work like that, and then we can go ahead and retest. But what we're seeing with the descriptions that Hazzard's providing and the way that I'm displaying it, which is not equivalent to the way that he writes about it, but it's the same concepts without me moving around. We're seeing the concepts of broad contact for multi-point discrimination. We're seeing the concept of working perpendicular to fiber direction. We're seeing relational motion. We're seeing multiple things here. And we can speak about it in a different way, and we can put your focus and your attention on one piece of it or another. In totality, it all sums itself up quite nicely. So we take a look at these older pieces of osteopathic literature, early osteopathic literature, we show them to you, and then we again, we consistently do, speak about concepts that I put forward. So you can identify maybe technical applications that you already know and apply the conceptual framework that I speak about to those methods.